patients with Alzheimer's disease lose the receptors in the brain, those little locks that the keys fit in. They lose those receptors in the brain for nicotine because those receptors are important in learning and memory. And we showed about 20 years ago or more that nicotine, a brief dose of nicotine, could help patients with Alzheimer's disease. And so we reasoned that if it helps early Alzheimer's, we might be able to move back even further into patients with mild memory loss to see if nicotinic stimulation or nicotine itself would help those patients with early memory loss. And what we found was that after 6 months, patients treated with nicotine were doing better in terms of memory and attention and performance on memory tests, and that the patients themselves and their families were able to notice some improvements in their functioning. We want to separate nicotine as a potential medication or as a treatment very differently from smoking. So we don't want people to go out, of course, and start smoking because that would have many terrible effects on their health. And in fact, it's been shown that smoking is bad for memory. So there's no question about that, especially in the elderly. But nicotine as a treatment might have some potential very separate from its role in smoking.